Morales, and I am the Collective Impact Coordinator at the Public Good Projects. You may have seen some emails coming from me, so I'm the person behind all those pesky emails, and excited to connect with you all today virtually, and hope to continue to meet all of you throughout the duration of the campaign. So for those who weren't on the initial, today's webinar is about data. So we're going to give you some more skills on data. And Weston has a great presentation coming for you, but I'll just kind of give you a brief overview of what things are looking like. We'll do a little housekeeping campaign. I'll just give you a quick 101 on what the campaign is and how to get involved. And then at the very end, we have some special guests on the call from some other really inspiring organizations and throughout the state of Pennsylvania to share some ideas with all of you. And then we'll do some questions and closing. So feel free. Just in terms of housekeeping items, we'll keep you all on mute throughout the presentation so we don't have any Zoom snafus like I'm always having. But that you're welcome to leave your camera on if you'd like. And then if you have questions throughout the presentation, just pop them in the chat box and we will get to them at the end. And then if you do get disconnected, just retry the original link and we'll let you back into the meeting. And if that doesn't work, stand by on your email and we will send next steps, but hopefully that won't happen. So just to quickly overview the Life Unites Us campaign. So I am with the Public Good Projects, and we are a nationwide nonprofit that works in health communications and behavior change. And we are working alongside Penn State and DDAP and Shatterproof on the Life Unites Us campaign, which is a campaign to reduce the stigma around opioid use disorder. And we're doing this by focusing on a people-forward, what we call a contact-based approach. And this is something that our team has developed through research and practice in anti-stigma work. We've found that connecting people through their stories and through similarities can and will reduce stigma. So we've brought that idea to Pennsylvania and in this campaign. But we know that as good as our research is, our approach is only as powerful as the community organizations and the people that engage with our work. So we can be as expert as we want, but if we don't have all of you on the call engaged in our work, it's not going to do anything. So I'm so grateful to have you all here today because you're really the people that are out there advocating, you're talking to families, you're talking to friends, and we hope that this campaign can be a resource for you to continue to do that work. So I should tell you what exactly the campaign is. So what we're doing is finding people throughout Pennsylvania who are ready to share their story, either of recovery themselves or of being an ally to someone going through recovery. So we're finding those people that are ready to share their stories. We're filming their stories, getting their testimonials, and then we're producing them in videos, photos, images, and sharing them back out on our website, on our Facebook, Instagram, Twitter, all the online things. And then we're also sharing them back with community organizations, hoping that you will want to use them in your day-to-day work, whether that's in a conversation you're having with school teachers or through your Facebook and Instagram. So the opportunity, we would love to invite you all to be official partners of the campaign. Some of you are, I recognize some of your names. Hi, everyone. And we'd be happy to put your logo on our website. And then we can also start to share with you directly partner exclusive content for the campaign. So different images and videos and things for you to use in your day-to-day work. So if you're interested in that and are not already engaged with us, please send me an email. I'd love to hear from you, either at Madeline Morales at publicgoodprojects.org or at info@Life Unites Us. And then you can also find us online at lifeunitesus.com and on Facebook and Instagram as well. So that's all I have for you today. I'm happy to answer any questions later as well. But I will pass it back over to Weston. Oh, the other thing I just quickly wanted to mention is that a large part of this campaign is we are doing monthly trainings and webinar series. So as an official partner of the campaign, you'll also have the opportunity to share with us your ideas for future webinars. So if you're like, hey, we really want resources on this thing, let us know and we will see what we can do. So this presentation that we have for you today is coming from feedback that we've heard from organizations around wanting to understand data a little bit more and get their hands on some of the stuff that Penn State has been working so hard on. So with that, I will pass it back over to Weston. Thank you.
Great, thanks, Maddie, for going over what the campaign is, welcoming people. Thank you guys all for being here with us today to talk about how to make decisions that are data-driven. So my name is Weston Kensinger. I'm the principal investigator on the Stigma Reduction Campaign here in Pennsylvania. I'm the director of the Douglas W. Pollock Center for Addiction Outreach and Research at Penn State, and we opened our center last August. So we're about a year and 3 months into it. I'm also an associate teaching professor of health education and biobehavioral health, but I'm not just an academic. I'm a person who's been personally affected by substance use disorder, opioid use disorder. It's personally affected me in my life, and I've lost friends and family members to it as well. So I'm not just some academic in the ivory tower coming down trying to give you guys information. I'm in a lot of the thick of things with you guys as well. So like Maddie said, today we're going to be talking about data-driven decision-making. And this was one of the things that when we reached out to community-based organizations in the very beginning of the campaign, people were interested in. So where do we find the data? How do we find the data? And how can we best use it? And from a personal note as well, working with community-based organizations, I've found this to be one of the most challenging things. In the field that we're all in, none of us got into it for the paycheck, right? Let's be honest. We're in it because we're very, very passionate about it. However, sometimes one of the bad things about that is we almost have blinders on and we see things only from our point of view. And we have to look more broadly and see what the data actually says, so we make sure that we're making the best investments of our time, our resources, and our finances. So I have 3 objectives. Hopefully by the end of my short presentation, you guys will all be able to meet. So hopefully, right, you'll be able to understand the importance of data-driven decision-making and how to use the data to enhance your organization's success. Some of you guys are from organizations that have been well established and you use data every day. Some of you guys are just starting out, and that's fine too. So, but how can we all use the data that's available to make the best decisions, right, for our organization so that we can continue that success? I'm going to show you guys a bunch of sources of data so that you'll be able to locate and access data to identify your needs, right? Plan properly. So what program are you going to offer, right? Make more informed decisions. These can be long-term decisions or short-term decisions. Be able to highlight areas of need within your own target audiences, and then also show progress in evaluation. And the third objective is, hopefully if I'm successful, by the end of today, after this webinar is over, you guys will go to some of the resources and the links that I show you, right? And you're going to be able to take a deeper dive into them and start using some of that data for your own decision-making process. Right? So what is data-driven decision-making? It's not anything that's scary. I teach statistics. I teach the research methods course here at Penn State. And every time I teach that, students come in and they're always kind of hesitant and scared, right? Because data makes people a little nervous. They might not understand the terminology. They might not know where to look for it. They might not be comfortable with it. But using data to drive our decisions is something that we all already do each and every day. Right? We all got up today and put on clothes, right? And we based what we were going to wear, right, on the data that we had. What's the weather going to be like? Right? What are we going to be doing today? Right? If you went into your office today, right, you use data to find the best route to get to your office. Right? What's the quickest way there? What's the route that's going to not use as much gas? Right? So we're already using data every day, and it's really time to start thinking about now applying it to what we do as our roles as professionals. It's a process of collecting, analyzing, understanding the data to influence our organizational decision-making. So why are we doing what we're doing? Right? Are we having our resources, right, targeted towards the best spots that they need to be? Right? We use analyzed data to make informed decisions instead of intuition. Like I just said, we are all passionate about what we do, and a lot of times we kind of go off that intuition. But does the data actually support those decisions? We don't want to necessarily reinvent the wheel or do things that are already being done, right? We want our own organizations to kind of stand out and have their own themes and their own missions. Right? It also helps to reevaluate short and long-term goals for organizations, right? So are we planning properly, right? And are we meeting those long-term goals, right? Those short-term goals? Are there any changes that need to be made? And we can look back to different data indicators, right, to help get a better idea of that. Right? So beginning this process, right, you have to know what your organizational mission is. What does your organization want to do? I work with organizations all the time, right, especially when they're just starting out, and they say, oh, we want to do everything. Right? That's very, very difficult to do, right? Know what your organization is set out to do. Are you focused on prevention? Are you focused on treatment? Are you focused on recovery? Are you focused on, a specific target audience, right? So maybe adolescents, right? Maybe the elderly, right? Who are you trying to serve? Find the unresolved questions, right? Find the gaps that need filled, right? And then start collecting that data now. And you should have started collecting data yesterday. It is never, ever, ever too early, right, to start looking for data, locating the data, right, and also collecting your own data to help you guys meet your goals and objectives, right, and carry that success forward. Right? It helps you to revisit and reevaluate your organizational objectives. So maybe you started your organization and you had a few broad objectives, right? Can we really tailor those objectives to what's being needed? So think about what your objectives are. Think about what data you need, right, to help support those objectives, right, and help support those goals. Right? It helps you present a clear and meaningful data in a dialogue as well. So when you're talking with stakeholders, right, you're able to speak to the specific statistics, right, within your own area and within the own people that you're serving, right? And it helps to draw inferences and understand patterns to make informed decisions. So as you look at different data points, charts, graphs, do you notice anything, right, that seems strange? Do you notice any trends or any patterns, right, that you can base your decisions off of to make better informed decisions, right, to help save you time, to help save you resources, to make you more successful? Right? Some benefits, right, of data-driven decision making. Right? You're going to make more confident and informed decisions because you know that you have the data there to support it. Right? And this is even on a low level as to recruiting people for your advisory committees or your steering committees, right? Who needs to be on those committees, right? What does the data say about that? How do you talk to people, right, and talk them in, right, to jumping on your advisory board, right? You're asking them to spend their time, right, working with you. So how do you use data to help you sell that conversation to them, right, so that they want to be on that advisory board, that they want to work with you? How do you, if you're working with prevention and you want to try to implement new prevention programming in elementary schools, right? What data do you need, right, before you approach that superintendent or that school board, right, to go and do your pitch to them so that they understand the need for more prevention programming, right? You're going to be more proactive, right? If you consistently look at the trends, right, you're going to be able to start to anticipate things, right? And once you see where the data is going, it gives you greater transparency and accountability, right? Especially with your goals and objectives, because you know the targets that you're trying to hit. I'm going to talk about SMART objectives in a second, but if you have specific targets to hit with your objectives, right, you're going to be much more able to evaluate if you're hitting them, right? And those objectives being specific, you're going to hold you accountable to doing what you're doing, right? Why you're doing what you're doing. Right? And finally, it's going to enhance your funding proposals. Every organization, right, needs funding to be successful. So we need to get funding from somewhere. Well, the grant proposals, right? You have to have the data to show the need in your community, right? If you want to extend grant funding, right, you have to be able to show your success. So start collecting that data, right, and continuing that the whole way through to show the success of your programs. But understand and improve services for your clients and your consumers. Right? What do they need? Right? What are they getting out of it? Right? Make sure that you're setting out to provide the services that you set out to provide. So if you think back to that last slide, the accountability, right? If you stick with the data, right, you're able to really focus in on those objectives and making sure that you're setting out to do what you said you were going to do. Everything is changing, and we know this in 2020 with the whole COVID thing. So as organizations, we have our objectives, right, and we have our goals, but that kind of changed. And sometimes we kind of wean off a path, right? If we hold back to the data, right, we can look and say, okay, are we meeting the metrics that we really set out to provide? Right? And it also, if you're collecting your own data, right, it helps you promote your services within the community. It helps you to show the need for the community. Why should the community buy in to what you're doing? Right? Why should they support your organization? How big of a problem, right, is SUD, OUD in your community? Right? Why should people care? Who does it affect? Right? So you can use data to support all of these things. Right? Again, it's going to show you how effective you are with your organization achieving its missions and its goals. Right? It's going to show your program effectiveness. So how effective are your services that you offer? Right? Are they doing what you're intending them to do? I meet with a lot of organizations and they tell me they're doing a lot of programming. I say, that's wonderful, great. How do you know if it's working? And oftentimes I hear, well, people are happy when they leave the programming or they leave the training. Just because somebody's happy, it doesn't mean that you're being very effective, right? Are you following up with the people that were in your programming and training courses, right, to see if they're making the changes that you asked them to make in the short term and the long term, right? Are your programs being effective with that behavior change that you're asking them to make? Right? Sometimes they are, sometimes they aren't. So if they aren't, what do you have to do to either make that more effective or even ask yourself a question as to, is this program actually needed, right? Or are the other 14 programs that we're doing, right, more effective, and we should invest our time and resources in those that actually are effective. You can also use data, right, to understand satisfaction from your clients and your consumers. So how does your community perceive the services that you're offering, right? Are they being valued? Are they, tools and skills that your community actually needs going forward? So the CDC lays out a 6-step process to kind of evaluate your organization. Right? The first is engaging stakeholders, right? So are you successful in engaging the stakeholders, right, and funding agencies? Are you able to write a full grant proposal and get that funding because you have the data to support it and to show the need for that funding, right? It helps you to describe the program, right? What exactly are you doing, right? Are you trying to, reduce overdoses, right, within your community, right? Or are you trying to, reduce overdoses by 50%, right, within 6 months within your community, right? It helps you be more specific and describe your program. It focuses on the evaluation, right? The implementation of your program versus the outcome, right? So process evaluation, right? Are things going as planned throughout your program? And outcome evaluation, right? Are you achieving the goals that you set out to meet? Right? When you think about using this data, right, it helps you to gather the credible evidence that you need, determine your indicators. What exactly are you looking at, right? And how are you going to get that data? Right? Is it publicly available? Is it from, a national, federal source? Is it from a state source? Right? Is it from a foundation? It's just that you have to collect on your own. It's going to help you to justify your conclusions, right? When you're analyzing your results and interpreting your findings, right? It really helps you to narrow in on what you're looking at, right? And you have the data to support your conclusions, right? Yes, our programs are very effective, right? Why? Because the data here shows it. The data shows that 65% of people in our trainings are, continuing to do what we're asking them to do 3 and 6 months following the program, right? We're being successful in what we're doing, right? And it also helps you with sharing your lessons learned, right? So making recommendations based on the findings of the data. So knowing what the data says, what should be done, right? What's recommended based on the data. You can always fall back on that data. And think about the clients you serve, right? Your target audience and your objectives. What do they need versus what is nice? And those aren't necessarily the same things, right? We only have, right, a set amount of funding, a set amount of time. So really knowing what your target audience needs, right, versus just what they would like to have, right, can really be the difference between having a successful program, right, and having one that's not as successful, right? It might be nice, right, to have, free Narcan trainings, right, every week of the year, right? But is that what they need, right? Do they need to have their awareness raised, right? Or is that just an added benefit to it? Right? But if you look at the data, you're going to be able to see what your target audience needs versus what they just think is nice. I mentioned this a little bit ago, but it helps to develop your SMART goals and objectives, right? Whenever you're writing your goals and objectives, be very specific, right? And look at the data. Are things achievable, right? Does the data say that it's achievable to do, right, X, right, within 6 months, right? It's going to help you to develop those goals and objectives if you know where you're starting at, right? And it's also going to help you to maintain your focus on those goals and objectives. So what are the things that you should be looking for? First off, demographics. Again, know your target audience, right? Where do they live, right? What's their household income? What's their race and ethnicity? What's their gender and sex breakdowns, right? You really have to know your demographics to understand your target audience, right? Look at what policies there are, right? So we have federal policies, we have statewide policies, right? And then we also have policies that are specific to, right, counties, right, as well as certain areas, right? So how do those policies impact the services that we're offering or not offering, right? Are they helping or hindering these services, right? Gather that data, right, to support and advocate, right, for policy change, right? And that goes along with service availability, right? Does the data show, right, that people in your service area have access to MAT, right? If so, great, right? Can we get them there now, right? Or maybe the data says, you know what? No, right? If people in my service area on MAT, they have to drive 4 hours to get it, right? Use that data, right, to justify, right, why you might need, right, to have more MAT options closer to your service area. Right? So what we're doing with all of this is we're kind of looking at where are the gaps and how are we going to fill them, right? What do we need, right? And then what's our plan to fill them? Not what's nice, right? But what do we need? What do our clients need? What does our target audience need, right? And then how are we as providers going to help fill that gap? So the second part of this is really using and locating that data. So, it's great if you want to know your demographics, but where do you go to get that? Where do you go to see, how many overdoses there are, right, in a certain area, right? And other forms of data to better understand your target audience, which we're going to talk about here in a second, right? So there's a ton of data dashboards out there, and the ones I'm going to go through today are all publicly available. They're all free, and you guys have probably used some of these, and some of them you may not have used, but they're really, really good. And these are by no means the only ones that you should be using. This is just a very short snippet of it. So make sure that you use useful variables related to the services you offer. So for example, if you're offering online services, right, is there high-speed internet connectivity in your service area? Right? It does no good to offer online services, right, if a large portion of your service area, right, doesn't have internet accessibility. Right? Think about cell phone accessibility as well. Right? So why would you use online advertising, right, if you have a very low cell phone connectivity, right, and a very, very low internet accessibility in your area, right? And as we all know, Pennsylvania is very, very, very diverse. I don't know if Bobby's on the call. I know she registered for it, but up in Clearfield County, right, that is very, very different, right, than somewhere like Berks County, right, or Allegheny County, right? So, the internet connectivity, the way they offer services, and what they offer is going to be very, very different, right? So there's not a one size fits all model, right? Know your target audiences and know what variables you're looking at, right? Use statistics that support your services, right, to provide and show the need for additional services. Right? So does there need to be an increase in Narcan and distributions? Right? Does the data show that you need more transportation to MAT? Right? Do you need more prevention programming? If you look at the data, it's going to tell you what is needed and where those gaps are, and then it's your job to go back and fill those gaps. So a couple of sources of data to consider. Again, this list is not exhaustive by any means, and I kind of went from a national broad level to down to a more specific level with these. So there's about 6 or 8 different data centers that we're going to look at very briefly. So first off, the CDC, right? They provide information on a national level. They provide great resources and data that can be helpful to consumers and providers. So the CDC is great if you want kind of an overview of everything. The data on this site is written, at a level that most people can easily understand. So if you're looking for national level data, right, the CDC is a very, very great tool to use. And we probably already all go to the CDC and look at data and different trends from the CDC. If you want to be a little bit more specific, right, you can go to SAMHSA, right? SAMHSA has more technical reports. They have a lot more data sets that you can look at, right, and filter down. They do a much better job than the CDC at showing breakdowns by state, right? And they have a whole host of other data sets, right, that you can use to really dive into that data, right, and find more specific results. DDAP, they do a fantastic job, right, with their data dashboards. And you can also access this through other state agencies. So they have interactive dashboards, right, to help you navigate data surrounding specifically drug and alcohol programs in Pennsylvania. So you can look at the Get Help Now hotline data. How much is it being used, right? What months is it being used in, right? You can look at overdose reversals by EMTs, right? Do the EMTs have the Narcan, right, to be able to do that reversal, right? Are we seeing trends in that data? And if you go to their open data portal, you can look specifically by state agency, right, and pull all of their data sets and build your own charts and graphs, right, to interpret that data, right, to look specifically at those variables that you want to find, and they're going to be best suited for you. Part of this campaign, right, isn't just the outward campaign social media website. Right? We're also developing data dashboards to help people like you, right, in better understanding, the data specifically within stigma, right, and also providing a narrative context to it, right? Because a lot of times, as I mentioned before, people kind of get a little nervous when they hear data and they hear statistics, right? So, the goal of these dashboards is really not just to give you the data that you can look at and play with yourself, but also provide that narrative context to it. So understanding what that data means. Right? Data is only good if people actually understand it. If you don't know what the numbers mean, right, then it's not going to be useful to you. So these dashboards do a very, very good job of providing that narrative context behind it. So within our web portal that we're developing, right, there's narrative dashboards, which we're going to go over in a second. We're using ArcGIS maps to find community-based organizations throughout the state close to you. We had that survey data from our first statewide survey up on Tableau dashboards. And these actually walk you through the survey and the data. You can look at it either in a view as just viewing the data or digging down into it yourself, right, and finding new trends, right? And these data dashboards are going to be able to be accessed through a link on lifeunitesus.com, or else Life Unites Us PA, which is the data dashboard website itself. So we are pilot testing these right now and refining them, and they're going to be available to the general public right here very, very shortly. And we will send out an announcement once they're ready so you guys can really go in and look at these. So this is an example of what you would see if you come to the data dashboard. We looked at specific groups. This one goes over the first responders data. So there's a quick video here, right, that shows once you get to the actual data dashboard homepage, you scroll down, data indicators and narratives, right? And you can look at different groups: criminal justice, first responders, institutions, medical providers, right? We chose to go with the first responders first, right? So this is talking about the introduction, right, to first responders, Narcan administration, right? And we have these data sets available that you can then click on your specific county, right, and see the statistics related to your specific county, right? It goes back at least until 2018, so you can start to look at a little bit of trends as we go. You can also filter it out specifically by year as we go through. Right? And we're just looking at different data from different counties. You can hover over the county, right, and it's going to pop up the data specific for that county. Right. The next one, right, is what we call the CBO map preview. So this is the ArcGIS mapping, right, that's going to be available through these data dashboards. You click on community-based organization map, right, and you can find community-based organizations wherever you are. You can zoom in to different locations. You can zoom out. Right? And then once you hover over a specific location, it gives you their contact person, the address, if they have a website, and the counties that they serve. Right? You can zoom in, right, to see specifically where they are. Right? And then you can also search in the search box up at the top as well for a specific location or a specific county, and a list will come up there as well. So we developed this list by contacting all 47 SCAs in late spring. They sent us a list of the organizations that serve their locales. We then contacted all of those organizations and asked them if they want to be part of the campaign. Those that indicate that they did, right, we're then putting those on the CBO map. So if you're not yet on the map, right, and you want to be on the map, let us know. Send us an email either to myself or to Maddie, and we'll make sure that your organization is represented on that map. And we also have the survey results tab, or the Tableau results. So this picture here is a view of what you can find if you go into these Tableau dashboards. You pull it up, and at the top, it shows, right, the question from the survey, right, and the responses. And then you can actually go through, right, and click on your region, right, which is defined by Department of Health, and all this data will change specific to the region. We have rural urban breakdown, gender breakdown, right, age breakdown. Right. To take it a step further then, you can also go over on the right-hand side, right, and look at the data by race, ethnicity, political ideology, political affiliation, income, educational attainment. So you can really get data specific to your target audience that you're trying to serve. It's not just state level data, right, but it's much more detailed, specific to where you are, so that you can better understand, right, the attitudes and beliefs towards stigma, right, in your own area. And then use that data to drive your programming based upon that data that you're seeing. Right? Because there might be overall state data that suggests something, but it might be completely different in your own specific region, right, or within your own specific target audience. So knowing that audience, once again, it's very, very important to make sure that your programming, right, is filling that gap that they need, right, giving them the services that they need. Right. Another great source of data, and I think that we have somebody from Pit and Overdose PA on the call. I know they were registered, right, but Overdose Free PA right, does a great job, right, showing different overdose death data and resource location data. If you haven't used overdose-free PA yet, I'll definitely suggest doing it. They are great with coalition building throughout the state as well. So definitely make sure to contact them if you're not aware of the services that they offer, but they're doing a great job at PIT through this overdose-free PA portal. Looking specifically at counties, right? You can use the county health ranking. So this is a website that allows you to compare health outcomes and risk factors in counties throughout Pennsylvania, right? And across the nation as well, if you want to go that far. But over on the right-hand side, you see a screenshot of what we pulled up if you look at county rankings in Pennsylvania. And I just selected Bucks County. So their overall health outcomes ranking is 5th in the state, right? Which is great. If you need demographic information, right, it shows the population of the county versus state, right? Percent below 18 years old, percent 65 and older, and you can see how you line up specific to the state, right? And then they also have their health outcomes, length of life, quality of life, and different health risk factors, obesity, smoking, substance use. So you can really dive down this data to really understand the people in your counties, right, where you're serving them. Right? And again, this helps build a stronger case for you when having those funding applications, right? When looking, where are those gaps, right? Are you doing really great in the state, right? Or are you lower down the list, right? And you can use some help in some different areas. And then the final one I'm going to talk about, or there's actually one more, but Policy Maps, right, is a great website. If you have not used Policy Maps, right, please go to policymap.com. This website is incredible. So they have a ton of different data and they get it down to the lowest level that they possibly can. So you can look across the United States, look at different demographics, right, different income and spending levels, right, different housing options. So, you know, the percent of people that own their home versus those who rent, right? If your county has a much higher percentage of people who rent, right, you're going to see a higher population turnover. So you might have to repeat programming on a more frequent basis, right, than if, you know, you have a large population that owns their home and they're there for their lifetimes, right? You can look at quality of health indicators, right, economic indicators, educational attainment indicators, specific health indicators. So the one that I selected here looks at opioid prescriptions per 100 people, right? And this is a nationwide view. And you can then zoom in directly to Pennsylvania, directly to your counties, and even down into zip code data if available. So you can find very specific information for this. And the last one I'm going to talk about is using Facebook. Right? We should not use Facebook to get our news, right? But they do have great Facebook insights and analytics. So if you are promoting your organization through Facebook, right, know your audience, know when you're going to engage with your audience, right? What time of day are they most likely to be engaged, right? Whenever you make your posting, right, are you targeting more males versus females? Are you targeting a certain age group? Right? If you use the Facebook's Insight tool, you're going to be able to understand, right, where your audience is, when they're getting that information, and that's going to help you, right, when you go to post information. Right? What time of day do you post information to get the most engagement? Are there certain days of the week that are better than others? Right? So using Facebook Insights can really help you better understand your audience and when to reach them as an organization looking to advertise. So before I hand it back over to Maddie, I mentioned this in the very beginning. Right? Some organizations already use data, right, and they're great at it. Right? Some don't use it at all, and they don't really know where to get it. They might be a little scared of it. So what I would really encourage you guys to do is after this webinar, either email myself, and my email address is wsk120@psu.edu, or email Maddie. And what we would love to find out is, you know, if you're using data in a really effective way and you think you're really good at it, can we partner you with an organization within the state right, who's kind of leery about it and who might not use it a whole lot. So you guys can learn from each other and start building collaborations, right? If you're not great at data, let us know, right? And we'll try and partner you with an organization that is really great at using the data, right? And if we can't find those partnerships, right, we will help you locate that data and use the data as well. Because while this campaign is about reducing stigma, it's also about providing you, right, as the people on the ground with the tools that you need to be most successful so that we can have an impact across the state. So thank you, and I will turn it back over to Maddie.
Thank you, Weston. That was amazing to hear all of that data. That's definitely not my expertise, so I certainly learned a ton there. And those dashboards are cool. Really excited to see those continue to build. So thanks for sharing all of that information. And yes, as Weston said, please be in touch with us with questions. But first, I am very excited to introduce some of our guests today from some different community organizations. So our first guest today is Mario. Mario Matha is a licensed social worker and program manager at the Helping Hands Ministry. It's based in Sharon, Pennsylvania. So he's going to share a little bit more about his organization and their mission to support families and family members in treatment or recovery as they reestablish themselves into the community and workforce. So with that, I will pass things over to Mario.
Thanks, Maddie. My name is Mario Motha. I'm a licensed social worker, and I am the program manager for Helping Hands. Specifically in Mercer County, we work with individuals and families that are impacted by opioid and substance use disorders. With regards to stigma, I lost my father at the age of 10 to a substance use disorder. As such, I can empathize with the internal struggles that families go through when trying to help a loved one, and having to deal with the public perception that addiction is a moral or a personal choice versus a disease. And that's where, again, we want to bring the science into the disease and make those connections with the statistics. Also, working in the community, we focus on changing public perceptions and stigma that's associated with addiction as a personal weakness or a choice. And what we do is we help individuals overcome the shame that's associated with being in active addiction and placing a focus on getting help and harm reduction. So individuals understand that it's a process and that it's not going to happen overnight, and that it takes time to peel those layers, because a lot of addiction, the disease of addiction is connected to childhood trauma. It can be connected to neglect or abuse. So that's why we put a focus on health and wellness. And then our second step is to connect individuals to counseling services to fill that gap, like what Wes is talking about, to do our homework, to do the statistics and take a look and see what type of help that individuals in our community need, and to make sure that we're getting them to where they need to go to. With regards to the statistics piece, fentanyl, cocaine, and heroin were the most frequently identified substances in Mercer County for overdosing, and that accounted for 74%. The most affected age groups were between 25 to 34, 35 to 44, and 55 to 64, which accounted for 78% of the overdose deaths. And most of these families have a lot of young children in there, and that's one of our, from doing the research that we found, so it becomes a generational problem. So again, that's why we want to intervene with families that are not able to go for an AA meeting or NA meeting because they have kids in the home, so that they're not able to go for a meeting and meet with a sponsor. So we create safe spaces in the community for them to come out and meet with us. And also, based on the statistics, we decided to, work with those individuals and families that are impacted by limited socioeconomic factors such as income, education, healthcare benefits, and community safety. So, for example, like fentanyl, cocaine, heroin, those are a lot of street drugs. So, again, that's why we wanted to make those connections to help those families that, understand the concept of people, places, and things, giving individuals positive outlets to focus on, being motivated to do things that are beneficial to figuring out what their life purpose is. And I think, when you listen to individuals get that feedback, you build a certain bond and level of trust, and you're able to promote the message of hope, and people appreciate that. So recovery is a lot of relationship building and getting to know the individuals that you work with. So that way the clinical piece is an easier transition. And right now, for example, one of the things that we're doing because of the pandemic, we're helping a lot of families with food. And also we do activities in the community. One of the things that we do is boxing. We go to the gym. Then we also do cooking classes. So different things. We listen to our participants to take a look and see what their interests are, and we try and connect them to those. And again, to Wes's point, we measure the statistics to see, are we, going in the right path? So by using our tools such as motivational interviewing, it gives us an opportunity to see what our participants are lacking, what that gap in service is, and then we make the effort to help them out. And the other thing is Maslow's hierarchy is our other tool. If someone doesn't have food or if someone doesn't have shelter and they're couch surfing, our research tells us that someone is not interested in recovery. They first want to make sure that they got food, that they got shelter. Once they've gotten food, once they've got shelter, then that's something you're able to sit down with, help someone to get them to counseling once you give them that stability. So that's why, we want to kind of work with other community organizations that are, kind of helping, that have the same goal of helping people and, helping them to figure out their purpose in recovery. And that's our final piece, that what we do is once we get individuals connected to whatever that gap in service is, we try and connect them to some education and training that's relevant for them to stay connected to the community that they live in. So that way, whether it's going back to school, getting some type of training, starting their own business, so that way addiction does not become a generational disease. Thank you.
Thank you, Mario. That was really, really cool to hear. And it sounds like you are already using all of that really important data. So thank you. Thank you for sharing and for all the work that you do. It's amazing to hear.
Hey, we appreciate it.
Yeah, of course. So our last guest today is Lori. Excited to invite Lori Wade to the stage, the Zoom stage here. Lori is the Executive Director of Lost Dreams Awakening, a recovery community organization based in New Kensington, Pennsylvania. So Lori is beyond qualified for this role with certifications as a recovery specialist, a family recovery specialist, recovery support supervisor, to name a few. And she's a passionate advocate fighting for the recovery community across the state and at the federal level. She's also started the LDA Grandparents as Parents program and developed the peer recovery support workforce, specialized training and supervision program to assist them as we're all navigating this COVID-19 world and other crises in 2020. So what I'm really excited to share is that Lori was named the 2020 advocacy winner by the Pittsburgh Recovery Walk. And this recovery award is bestowed upon an individual who has worked to change policy or public opinion about addiction and recovery. And Lori received the award and proclamation from Pittsburgh City Council. So I'm excited to have Lori's input today and have her share a little bit more about the work that she's doing at Lost Dreams Awakening.
Thank you, Maddie. And thanks to Wes and to Mario and everybody who put this together. My name's Laurie Johnson Wade, and I am a woman in long-term recovery. And what that means is I haven't found it necessary to get off the recovery pathway since May 30th of 1991. So I'm working on my 30th year along with my husband, Dr. Vonzel Wade, who's also on the path since 1991. So we felt it was a reasonable response in our community to create such a community organization as Lost Dreams Awakening. So together with my husband and myself and some stakeholders that were invested in the same mission and vision, we started LDA in 2014. So I'm really excited about that. We're a member of the Association of Recovery Community Organizations in Washington, D.C., and they are the gold standard for recovery community organizations. I'm on their membership committee and also their research committee. And it's a great privilege to serve in that organization because they watch policy, we do advocacy, we do education, we do celebration, and we operate under that model that they have been operating in much longer than we have. One of the things that they do in terms of data analysis and collection is they have what's called a recovery data platform. So along with Faces and Voices of Recovery, they enlisted the assistance of Recovery Trek to come up with this recovery data platform, which is a cloud-based software that helps to give you tools and assessments to effectively implement peer recovery coaching and programs. So we do utilize that. The simplest form of data collection that we do is our sign-in sheets. So using that, we are able to tell you with great confidence and evidence that we serve over 7,000 visits a year as a nonprofit organization that operates primarily on grassroots efforts. So that's pretty impressive. One of the things that we have been able to do during COVID-19 is to hold space for the displaced. So during COVID-19, LDA has never missed a beat. We have been open every single day because we are host to a lot of support meetings for individuals, for families, for community endeavors. And we have remained open, of course, teaching good citizenship with adhering to COVID-19 guidelines. So we're able to impart that to our participants and make them aware of what the guidelines are and model it. So modeling good citizenship. So we've been able to do that for our substance use disorder recovery community. We pride ourselves also in being recovery historians. So, you know, regardless if it's good, bad, or ugly, it is what it is. So we acquire knowledge through investigation and through interviewing and through some of the things that serve our community. So those are some of the things that we do at LDA. Now, let me tell you that one of the things that I'm extremely excited about, and I have to applaud you guys for this, you know, anti-stigma campaign. That's one of the things that we educate around. And I would challenge those who are in this work against stigma to go a little bit beyond. Let's deal with stigma and discrimination, because while they have similar nuances, they're different. They're different. And some communities deal with both. You know, we know that Black and Brown communities, the LGBTQ plus communities, some of those folks, even seniors sometimes, may deal with both. So I would challenge those who are in positions to affect change to not only deal with stigma, but also discrimination. And together, I think that we can come up with a viable solution to combat both. Now, I must say this in closing. I believe that the recovery community has the template for unity for the nation. I think we possess the template for unity because we come together with one common goal in mind, and that's to save each other's lives. And I think that that transcends all the differences. Whatever else is going on is secondary to the fact that what do you want to do about your problem and how can we help? That's all we want to know. And so in doing that, everything comes racing to the surface that is necessary to help a person not only find recovery, but maintain recovery. So, and then we celebrate that. You know, we reinforce it with celebration and say that we're just glad that you're who you are, regardless of what you look like or anything. So I am really excited about the work that we do. November is Gratitude Month. And so what we're doing at Lost Streams Awakening, we have launched a Grateful Giving campaign where we ask some of our folks to give a penny a day for your days in recovery, or do a random act of kindness, or perhaps you want to come and do a service project. So we encourage and we celebrate during the month of November grateful giving. And please go to our website, loststreamsawakening.org, and check us out. We have a lot of resources on there free. I forgot to mention, our services are free. So we don't charge a dime. They are non-clinical. Let me say that. They're non-clinical services, and they're in no way meant to replace clinical services or diverse pathways of recovery. So we offer our services for free. And the divine has been faithful in us continuing to allow our doors to stay open. And I'm thrilled to have participated with you folks. I love great minds, so I'm in great company here with you folks. And I can't thank you enough for the invitation. And have a nice Thanksgiving.
Thank you, Lori. That was truly the hope and inspiration that I needed today. So thank you for those words and for all your work. We'll wrap up here. If you have any questions, feel free to pop them in the Zoom chat here. But I'm also going to share, I just put in the chat a link to a survey, and we'd really love your feedback on this webinar, and also on your feedback for what's to come. So if you take just a couple minutes to do that, that'd be great. And we will follow up with the slides in an email. We can share that. And then also coming down the pipeline is more webinars. So next month we'll be doing these monthly trainings. So on the slide right now are some examples of kind of different topics that we'll be talking about in future webinars. So definitely stay tuned and keep us posted if there are specific things that you're interested in hearing. And other than that, mark your calendar for November 24th at the same time at noon. That will be our next one, and find us on social media and be in touch. So thank you, Weston. Thank you, Lori. Thank you, Mario, for being here. And thanks to all of you for hopping on today.
Great, thanks, Maddie. So are there any questions anybody wants to pose right now as we wrap this up? No? Okay, we're not hearing any. I want to thank you guys all again. So thank you, Mario and Patty and Lori, for joining us today. You guys are doing great work out in Western Pennsylvania. You guys are very, passionate about what you do. You guys are saving countless lives. So seriously, thank you from the bottom of our hearts for everything that you do for your communities. Because without people and organizations like yours, we can't begin to, slow down and these overdose deaths that we're seeing. So you guys are doing great work. Again, thank you so much for being part of it. And thank you, Maddie, and the PGP and Penn State team for all that you've done to help us with these webinars. And of course, thank you to DDAP for giving us the opportunity to develop this and reach out and try and help to reduce stigma across the state. So thank you, everyone. Have a great rest of the day, and we appreciate you being here.
Thank you.